difference.
Our last volunteer, Paul, who hopes to once again flip his hair like a rock star, is about to undergo the most intrusive treatment, a hair transplant, and he is thrilled.
I actually kind of feel like I've won the lotto. I mean, you think of all the people who want to have this done, and I got picked.
And Dateline is paying for the procedure, as we did for all of the treatments. Still, many people might have second thoughts about a transplant because of images like these. Rows of hair plugs implanted into a scalp that often looks strange, what some call the plastic doll head look. But Dr. Alan Bauman, a hair transplant surgeon, says medical advances have eliminated that plug look from years ago.
Today's hair transplants are 100% undetectable. There may be people that you know who have had hair transplantation and you are unable to tell.
Good morning, Paul. Welcome.
But to get that look takes a lot of money and man-hours. Plus, there are risks.
Infection, blood loss.
As Paul quickly realizes when he arrives at Dr. Bauman's office for his operation.
Transient swelling, bruising.
The car's right outside if you want to turn around.
Tell them to go ahead and go home. And I'm going through it, for sure.
After taking medication to relax, Paul jokes about the strange-looking laser hood that's used to stimulate his scalp.
Captain, I'm giving you all I can, Captain.
And then Paul gets a final consultation.
A year from now, 10 months from now, what will his scalp look like?
Well, he's going to have a brand new hairline, so it's going to be a lot lower, a more youthful position, and he's going to have a hell of a lot more coverage all through the top front area. So that front half of the scalp is where we're focusing our effort today.
And he wants it down to here, I think. That's what you're asking for, right, Paul?
Well, we're going to talk about that.
Dr. Bauman marks with a pencil where he plans to implant the new hair.
Does that kind of match with what you were thinking of?
Yeah, absolutely.
Okay, Christy.
As Paul enters the operating room, he'll need to get comfortable because he won't leave for 7 hours.
Put your hair up.
The donor hair comes from the back of his head.
You have beautiful donor area.
Because it's genetically immune to that hair loss hormone, DHT, erasing the worry that it will fall out like Paul's old hair.
We're going to start the anesthesia, okay?
Okay.
After numbing his head, the doctor removes a small section of his scalp. Because this is extremely graphic, we're only showing a portion of this procedure. Technicians then cut out individual hairs from the donor's scalp.
What I'm doing right now is I'm making the tiny incisions, the sites, where the hair is going to be implanted into the skin.
Paul remains relaxed the entire time.
Kind of sounds like scratching noise. No pain. A little pressure. But, I mean, not even close to what I thought I would be feeling.
Then the doctor and his team replant about 1,900 individual hair follicles.
The grafts are about the size of a fraction of a grain of rice. We're just glorified farmers here, that's all we are. We're planting the seedlings of hope here for him.
7 hours later, the process is complete.
It was a good case. Your skin handled the procedure very, very well.
And then a first look.
That's a lot of grafts. Wow. If that fills in, you weren't kidding, Doc. I want to look like you.
This procedure cost about $10,000. And Dr. Bauman has instructed Paul to start using Propecia and minoxidil to help keep his old hair from falling out. But for now, he's only thinking about new hair growing in.
It's instant gratification. I mean, I got to take a look at my hair and go, wow, in 3 to 6 months, my hair is going to be there. It's going to be way down here, back where it used to be.
But will Paul's transplants take? And will this fulfill his dream of getting back the kind of hair he once had? Will any of our men see the results they're hoping for? When we return, we check back 6 months later with each of our Follicle 5 to see who is growing new hair and who is not. You may be surprised by the results.